Erythromycin is a type of antibiotic called a macrolide. It is used to treat many different types of bacterial infections and can also be used to prevent some infections. Erythromycin works by stopping the growth of bacteria. It's important to note that this medication only works for bacterial infections and will not work for viral infections like the common cold or flu. Using antibiotics when they are not needed can cause them to not work for future infections. The medication is usually given through a vein, as directed by your doctor, every 6 hours. It should be injected slowly over 20 to 60 minutes. Erythromycin may also be given continuously. You should only use this injectable medication until you are able to take an antibiotic by mouth or until your treatment is finished. The dosage and length of treatment are based on your medical condition, weight, and response to treatment. If you are using this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Learn how to store and discard medical supplies safely. For the best effect, use this antibiotic at evenly spaced times. To help you remember, use this medication at the same times every day. If you are using this medication to treat an infection, continue to use this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Tell your doctor if your condition lasts or gets worse. If you are using this medication to prevent certain bacterial infections, use it exactly as directed by your doctor. Do not stop using the medication without your doctor's approval. Some common side effects of Erythromycin Lactobionate 500 mg intravenous solution include nausea, vomiting, diarrhea, stomach pain, or pain/redness at the injection site. If any of these effects persist or worsen, notify your doctor or pharmacist. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Contact your doctor immediately if you experience any serious side effects, including nausea/vomiting that doesn't stop, hearing changes, severe abdominal/stomach pain, unusual weakness/tiredness, dark urine, yellowing skin/eyes, or muscle weakness. Seek medical help immediately if you experience severe dizziness, fainting, or fast/irregular heartbeat. This medication may rarely cause a severe intestinal condition due to a bacteria called C. difficile. Contact your doctor immediately if you develop diarrhea that doesn't stop, abdominal or stomach pain/cramping, or blood/mucus in your stool. Do not use anti-diarrhea or opioid products if you have these symptoms, as they may make symptoms worse. Prolonged or repeated use of this medication may result in oral thrush or a new vaginal yeast infection. Contact your doctor if you notice white patches/sores in your mouth, a change in vaginal discharge, or other new symptoms. A very serious allergic reaction to this drug is rare. Get medical help immediately if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before using erythromycin, tell your doctor or pharmacist if you are allergic to it or any other macrolide/ketolide antibiotics. Also, let them know about any other allergies you have and ask your pharmacist for more details. Before using this medication, tell your doctor or pharmacist about your medical history, especially if you have kidney disease, liver disease, or a certain type of muscle disease. Erythromycin may cause live bacterial vaccines to not work well, so make sure to tell your healthcare professional that you are using erythromycin before getting any immunizations or vaccinations. Erythromycin may also cause a condition that affects the heart rhythm, which can rarely cause serious symptoms that need medical attention right away. The risk of this condition may be increased if you have certain medical conditions or are taking other drugs that may cause it, so it's important to tell your doctor or pharmacist of all the drugs you take and any medical conditions you have. Low levels of potassium or magnesium in the blood may also increase your risk of this condition, so talk to your doctor about using erythromycin safely, especially if you use certain drugs or have conditions that may cause low levels of these minerals. Before having surgery, let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Babies may be at higher risk for a certain serious stomach problem, so contact your child's doctor right away if your child vomits or becomes irritable with feeding. Older adults may be more sensitive to the side effects of this drug, especially hearing loss and heart rhythm problems. During pregnancy, this medication should only be used when clearly needed, so discuss the risks and benefits with your doctor. And if you are breastfeeding, consult your doctor before using this medication. When taking erythromycin lactobionate 500 mg intravenous solution, it's important to be aware of potential drug interactions. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Some medications that may interact with erythromycin include digoxin, amiodarone, dofetilide, pimozide, procainamide, propafenone, quinidine, sotalol, azole antifungals, certain calcium channel blockers, quinapristine, dalfopristin, sequinavir, carbamazepine, phenytoin, valproate, bromocriptine, alprazolam, midazolam, triazolam, colchicine, elatriptan, sildenafil, tadalafil, ergot alkaloids, statin, drugs, and vinblastine. It's also important to note that this medication may interfere with certain lab tests, so make sure your doctors are aware that you are using erythromycin. If someone takes too much erythromycin lactobionate 500 mg intravenous solution and has severe symptoms like fainting or difficulty breathing, call 911. Otherwise, call a poison control center immediately. U.S. residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Medical tests may be necessary while taking erythromycin lactobionate 500 mg intravenous solution. It's important to attend all scheduled appointments and consult your doctor for more information. Be sure to take each dose of the medication on time. If you happen to miss a dose, consult with your doctor or pharmacist immediately to figure out a new dosing schedule. Don't take extra doses to make up for the missed one. Check the product instructions and talk to your pharmacist about how to store the medication. Keep all medications out of reach from kids and pets. Don't throw the medication in the toilet or down the drain unless you are told to. Get rid of the product when it's expired or you don't need it anymore. Talk to your pharmacist or local waste disposal company for help. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.